Well, the nurses have been driven to this by the government, and that's a badge of shame for the government. They've never taken strike action before. And for patients, this is going to be devastating news. Nurses don't want to go on strike. And now it seems the Health Secretary is not even prepared to get around the table to continue negotiations to avoid the strike. And frankly, if the government is that tired of governing, then they should get out the way and allow a different government to come in and deal with the underlying questions like the lack of staffing. We want to train up 15,000 new staff to come in. Cavalry is coming under a Labour government. We wouldn't sit on our hands as this government is doing.
It's about working conditions. It's mainly about pay, though, Mr Starmer. Would you support their pay demands?
Well, look, it is about pay, but it is also about staffing, because talk to anybody in the NHS, my wife works in the NHS, and they will tell you they're under so much strain when it comes to staffing. And that's why our plan to use money by getting rid of the non-dom status and using that to train up 15,000 new doctors is a very important part of the discussions, because the NHS needs to know the cavalry are coming. But so far as the pay is concerned, what we would do is get round the table and resolve the issue. You would never have a Labour Party Health Secretary saying, I'm not going to get round the table and continue discussions. And the proof is there. When Labour were in power, we didn't have strikes of nurses, and actually we had fair pay for nurses. So the difference between what Labour would do and what this government is doing could not be starker.